Welcome to another edition of Champaign County Healthcare Consumers Healthcare Fact Chat. This is a sort of urgent edition. My name is Claudia Lennhoff, and I'm the Executive Director of the Healthcare Consumers, and I'm joined, as always, by
Adani Sanchez, Client Services Coordinator.
And the reason that we're doing this Healthcare Fact Chat today is because there's a very real and imminent threat to the Affordable Care Act and to the Medicaid program, because the Senate Republican leadership is still actually trying to see if they can get a repeal bill passed using the budget reconciliation process. And their opportunity to do that runs out September 30th.
Right, so they're rushing in to get into this window to use this process that only requires a simple majority.
Yes.
So they don't have to worry about actually trying to work with other legislators to get an actual, the actual legislative process.
Right. So at the end of July, when the process ended after John McCain and Lisa Murkowski and Susan Collins voted along with the Democrats to say no to the bills that were being proposed, the Senate went on a hiatus, on a break during the month of August. And the Senate parliamentarian recently said that the window on the budget reconciliation process for healthcare ends September 30th. So that's next week. And the bill that's being pushed now is the Graham-Cassidy bill, also known as Graham-Cassidy, Heller, and Johnson bill. And it is a monstrosity of a bill. It takes all of the worst previous legislation that was being proposed for repealing the Affordable Care Act and slashing Medicaid funding and actually makes it even worse.
Yeah, it kind of pushed it all together and then skewed it into an even worse direction.
It's really terrible. And we do have a sense of urgency about this. The Senate Republican leadership is meeting in Washington, D.C. today, and they're trying to twist arms and bring this bill to the floor. And what we've been hearing is that if Mitch McConnell does bring it to the floor next week, that means that he's got the votes lined up. So we really need to take this time between now and, the end of September. We just simply cannot let up. But basically, just in terms of time frame, if there is going to be a vote on this bill, it would probably be on either Wednesday, Thursday, or Friday of next week. And so between now and then, we just really have to sound the alarms and get people mobilized and activated in opposing this bill. And we can talk a little bit now about what's in the bill.
Yeah, so one of the bigger things that we talked about is the way that they have changed the way that they handle the money. So it does block grant Medicaid, but then it also cuts all other financial assistance programs in 2026.
So the subsidies that people can get through the marketplace to help make their health insurance, their individual plans more affordable, those subsidies that lower the cost of your monthly premiums, that money goes away.
Yeah, it goes away. They take it out, and then, so it's not just affecting Medicaid. They're not just cutting Medicaid. That was a big thing that happened that we saw a lot in the bills that were brought up this summer, is just cutting Medicaid, bringing it down. But this is not only cutting Medicaid, it's also cutting the financial assistance and then completely ending it on the marketplace and Medicaid. So it's completely ending federal funding. So a lot of these states that were getting money for their Medicaid programs, a lot of states that were getting money in their marketplaces, that's all money that's going to disappear.
So basically, this bill, it takes all of the federal funding that was added to expand health insurance through the Medicaid program to make health insurance more affordable through the marketplace. It basically takes that money, block grants it, and then ends the funding in 2026. So I just want to say something really quick right now about single payer, because there's a lot of excitement and interest and enthusiasm in single payer legislation right now. And I understand that enthusiasm, and I share that enthusiasm for the groundswell support in this nation for single payer. But we have to keep our eyes on the prize. And what people have to understand is that if this Graham-Cassidy bill goes through and they are able to cut this funding, not just for the subsidies and for the Medicaid expansion, but there's also deep traditional Medicaid cuts in this bill as well. If that funding goes away, those are our federal dollars for health care. And those dollars would go away. Any single payer system that we come up with is going to need those dollars in the budget. And so it's really important that we fight to protect that money now and of course, protect people's lives. So if you care about single payer, you need to also care about fighting against this bill and trying to make sure that we protect federal funding for health care. Right now, that federal funding is in the way of, subsidies and in the way of expanded Medicaid and also traditional Medicaid, but we have to protect that funding. So let's talk a little bit about the Medicaid provisions. As you said, it would issue these short-term block grants through 2026 for the Medicaid expansion, maybe. But the funding formula is grossly inadequate. It fails to account for actually a significant portion of the Medicaid expansion, and it also includes massive cuts to traditional Medicaid. This bill sort of preserves a lot of the BICRA, remember that? The Senate's healthcare bill, BICRA's Medicaid provisions, but the language that you'll hear about is that this bill creates state flexibility. And that's how they're trying to sell this bill. Flexibility is nothing but a euphemism for funding cuts and also for making the lives of lower income people much harder. Flexibility would come in the form of imposing working requirements or imposing more frequent redeterminations to qualify for Medicaid. Time limits and things like that. So don't fall for that. I don't want to get into too much of the details of Medicaid except for to say this bill would decimate the Medicaid program, and not just the Medicaid expansion, the entire Medicaid program. If people want to read a more detailed account, there's actually a Health Affairs blog. People can Google that, Health Affairs blog, written by Sarah Rosenbaum, called Graham-Cassidy, A Closer Look at the Medicaid Provisions, and that gets into a lot of details. But this bill should also frighten people who have not just individual health insurance, but employer-based health insurance. And do you want to talk about that?
Yeah. So just like in other iterations of the ACA repeal, this is again in the name of state flexibility. This bill is allowing for waivers. States can apply for waivers to key Obamacare like regulations, key ACA legislations that kind of standardized our health insurance and made it so that you can't be denied based on any pre-existing condition. You can't be charged anymore because you have pre-existing conditions on your premiums. So this is allowing essential health benefits. This is allowing states to be able to opt out of some of these regulations and then opening up an avenue for private health insurance plans, employer plans to be able to offer you coverage and charge you more for that coverage that maybe is substandard.
So we would basically, if we lived in a state that took up the waiver, we would basically go back to the pre-ACA days, right, when state regulation determined what insurance companies could and couldn't do, and what they used to be able to do is to charge more for pre-existing conditions or have an incomplete set of benefits and things like that. So if you have employer-based health insurance, you would not be safe from this bill. Right. So those state waivers are really dangerous, and policy analysts, healthcare policy analysts, estimate right now that they think that about 50% of the states would actually take up these waivers, not because they want to hurt their residents, but because with reduced funding, they would have to make difficult decisions about how to cover people, who to cover, what things to cover, and things like that. So it's very dangerous. But now let's talk about the CBO. Because normally when we're looking at major legislation, especially major legislation that controls a sixth of the economy of the United States, we would be hoping to get a CBO score that would have two parts to it, two components to it. The CBO score should have one component which has to do with the dollars. What is the cost? How much does it cost? The second part of it, especially with regard to healthcare legislation, is it would look at the impact on the rate of the uninsured. Right. And the CBO has said that they will not be able to fully score this bill by early next week. And in fact, under the budget reconciliation rules, the Senate is not even required to have that second part of the score that deals with the uninsured rate. They're only required to have the financial estimate of the score. So what a lot of people are doing in the calls to action is saying, call these senators and tell them to oppose the Graham-Cassidy bill. But the other part of the message that people can add is to say no vote on Graham-Cassidy until there is a full CBO score.
Right.
And that would be sort of more of a return to regular order, as John McCain had advocated for. So why don't we talk a little bit about the call to action? So what we're asking people to do is, to gather your energies again and start making those phone calls and help spread the word. We sent out an action alert yesterday where we included several senators, Senator Capito, Senator Murkowski, Collins, Gardner, Flake, although I think he's already said he would support it, and Senator Portman, and calling on them and asking them to oppose Graham-Cassidy. And I know we live in the state of Illinois. Our senators are opposing this, but we think that because this is not regular order at all, and because our state would in particular be adversely impacted in the Medicaid formula, we would lose millions and millions of dollars in Medicaid, that we think it's okay for people to go ahead and call these other senators and tell them to vote no.
Right.
Everything's out of order, so constituents of one state, I think it's fair to call senators of other states, but also call our senators as well, so that they can say that they're hearing from their constituents.
Yeah, and I think it's important to these are, again, similar characters that we had in the summertime. These are some of the people who are on the fence, who aren't sure, but were swayed by, or I mean, not really swayed.
They were.
But they felt the impact of being called by people, and again, like you're saying, we're going to be affected by this. And again, with all the other stuff going on right now, it's easy to get distracted and easy to really not hear from anyone about healthcare. So I think this is, again, very important to kind of bring up and remind these people that there are people who still care about healthcare and are still very worried about the changes that are being proposed.
Yeah. And just in closing, I just want to say thank you to everybody for all of your activism, throughout the spring and summer. But again, please don't sit this one out. It's not over. It's not over. This is really super important, and we try, we don't unnecessarily alarm people. I am alarmed by this bill and the momentum that it's gaining. I am alarmed by the Senate Republicans who are worried about a procedural window closing and just want to have, a victory to list, regardless of how it impacts the nation. And I think, I'm also alarmed now because, the cuts to Medicaid would be just absolutely devastating and far-reaching, but we also need to remember that this is being proposed during a time when parts of our nation and the world, but our nation, are suffering from massive natural disasters where people have lost their homes, their communities have been wiped out, they've lost their jobs. With their jobs go their, health insurance, and people are going to need Medicaid more than ever. This kind of bill would make it very difficult for states to respond to needs, within their communities. So this is not a false alarm. It's time to reactivate, and please talk to your friends and your associates and get people to take action. Share our action alerts. We'll continue to issue more, and we'll try to keep you up to date. But please make those phone calls, even if it's at night. You can make the phone calls and leave voicemail messages.
Someone has to listen to this.
Yeah, they do, and they have to list them. So thank you very much. And